Hello, welcome to Health Smarts. Today we're going to talk about something that I've probably been asked, I don't know, maybe 500 times in the last 48 years. What's the best health plan for me to buy? The problem is, it just really depends on your situation. First, though, let's talk about what health insurance versus health benefits are. Health insurance is a protection against a big loss. That's how it originally started. People didn't want to lose their whole inheritance. They didn't want to lose everything they worked for if they had to go to the hospital. So they'd pay a few bucks for a plan that would protect them in case they had a big loss. What happened though is in the 40s, companies were trying to figure out how to get people to come to work for them. So they started buying health benefits, not health insurance. The difference is the employer bought things that people wanted. Say, hey, look, come to work for us. You go to the doctor, doesn't cost you anything. Hey, go to the pharmacy, we'll pay for it. Over the times since then, all kinds of permutations have happened. But the bottom line is health benefits are now thought of as health insurance. I did ask you a simple question. Does your auto insurance pay for oil changes? Of course not. If it did, think how much more it would cost. Because the insurance company would have to pay for the oil change, plus pay for the claim, and pay for all the administrative stuff. So, just like I had to adjust my glasses there, you have to adjust your thinking. Health insurance is something you buy if you have to pay for it to take care of the catastrophic loss. Now, if you're listening to this and you're thinking, what's the best health plan if I'm an employee? The answer still boils down to this. What is going to be right for you? You got to look at several factors, one of which, the first one probably is your doctor in network? The second is, okay, is the deductible so big that it would break me if I had something major? The next is, oh, am I on a bunch of medications? And how does this plan treat them? Now, many times the sad truth is generic drugs can be purchased directly for less than they can through a group health plan. Because what the group health plan build does is they charge the people that take generics maybe 10 or 15 bucks. But that lets them get the big brand names for half the cost. So look carefully at what you're buying. I still believe that for the majority of people, a health savings account is something you should look at. And remember why. It gives you a triple tax advantage. When you put the money in, you deduct it. When you take the money out, you don't pay tax as long as it's for qualified medical expenses. Like I've said before, not for that drink on Friday night, but for qualified medical expenses. And I know maybe that's qualified for you, but your doctor would have to write you a script. So the next thing is, and this is where most people miss the boat, it's the compound interest on the money inside of your IRA. That's right, it's a medical IRA. The money goes in, you deduct it. You grow tax-free. But here's the big difference. A regular IRA, when you turn 70 and a half or whatever they move the required minimum distribution age to now, you got to start taking it out, paying taxes on it. A medical savings account, you don't if you use it for qualified medical expenses. So if you would need, well, let's say a nurse to come in and take care of you for a few days, your medical savings that you've put in there, all that money you've put away, plus the interest over all the years, you take out tax-free. You pay for it with your IRA, or you pay for it with income you earned, you pay taxes. So that's why I tell people, look carefully. If you have an HSA available through your employer, it might be a better. Main thing to remember is every person's situation is different. So if you have a question, feel free to reach out. I'll be happy to give you some ideas.